Hello, I'm Dr. Brandt Gibson, and one of the things that we commonly treat are bunions, and we've talked about bunions already in one of these videos. But one of the other names for a bunion is hallux valgus or hallux valgus. What does that mean? What is a hallux valgus, or what is hallux valgus? So if you take a foot model here and you start looking at all the toes here, and this is the hallux. The big toe, or the great toe, is the hallux. And so hallux valgus means that the hallux is angled towards the other toes. It moves in the valgus direction towards the other toes. So when you have a bunion and the first metatarsal curves in that direction, in the varus direction, and this goes in the valgus direction, then you start to get what's called a bunion right here. But you can have a bunion, which is the bump here, and also hallux valgus, which is an additional problem or an additional thing. And in the treatment of a bunion, if it's just the bump here, you'll treat it differently than if you have a true hallux valgus. Then you have to do motion, or you have to do a type of surgery that will actually treat both problems. Sometimes in evaluating it, you're saying, okay, I may need to do a little bit more surgery on the hallux itself, not just the first metatarsal, depending on how much valgus is going on. That being said, because that's hallux valgus, you can also get a side effect of the bunion, which would be hallux varus, where the toe is curved out there. That is likewise a problem and should be minimized, because if you get a varus, you can see how that would be a problem also in going in your shoes. So hallux valgus is an angling of the toe towards the littler toes. And that also may need to be treated if you have a bunion deformity. This is Dr. Brandt Gibson, and this is your podiatry tip